everyone, and welcome. I'm Jamie Callie with RWJBarnabas Health Medical Group. Today we're talking about flu shots and flu season, and I'm joined by Dr. Strauss and Dr. Patel. Welcome to you both. Thank you for joining us today.
Thank you for having us.
Thank you for having us.
Absolutely. If you are joining us on the live and you have any questions for our doctors, you can type them in the chat during the webinar, and we will do our best to answer them for you. And if you're joining us on the recording, welcome to you as well. Let's sort of dive right in. So we're talking about flu and flu season, and I know it's sort of a hot topic item on the news channels and everywhere right now as we're headed into those cooler months. What would you say is flu season when we talk about flu season?
Flu season traditionally is between November and April. It's most commonly when we're closed up, the windows are closed.
Mm-hmm.
There's a lot of interaction with people in closed areas. But you can get flu throughout the year. So it's not something that just happens in that season. It's just that it's most commonly going to land in that time. That's when most of it's transmitted.
Okay, so that's important because I think a lot of us tend to think of the season as being, like you were saying, sort of like those winter months.
Right.
And sort of once we break outside for spring, flu has sort of disappeared, but it hasn't.
No, it hasn't. It goes year round. And that's an important thing to remember. In recent years, we haven't been seeing as much flu because everybody's been distancing and masking because of COVID. And flu gets transmitted the same way COVID does. It's through coughing and sneezing and not washing our hands. And in the winter months, where, as I said, windows are more often closed, so our germs get more concentrated in our houses and our stores and stuff like that.
Excellent. And so because, like you're saying, you can get the flu any time of the year, what would you say is the most important factor to getting your flu shot?
So the most important reason to get your flu shot is to prevent the risk of flu-like illnesses and spreading the flu. Also reducing the risk of hospitalizations and complications related to the flu. Although you can still get the flu even if you've gotten the flu vaccine, what helps with getting the flu vaccine is it reduces the severity of the illness overall.
Right. So even if you do happen to contract it, you're not going to hopefully be out of commission for 1 to 2 weeks, something like that.
Exactly.
You have milder symptoms.
Right.
Excellent. And who do you recommend get the flu shot?
I think everybody should get the flu shot, but especially those who have respiratory illnesses or are high risk of getting complications, like people with diabetes, heart disease, are elderly. But everybody should get it because you're not only protecting yourself, but you're protecting everybody else around you.
Dr. Patel, do you have the same guidance for flu shots?
I agree. Yep, I think everybody should definitely get a flu shot.
Excellent. And I know we talked about, you touched on it briefly, Dr. Scott, if you're someone who's in that sensitive sort of grouping, but also if you work with someone or live with someone or know someone, like you're saying, it creates that sort of immunity for everyone around you as well.
Right. And there are some people who can't get the flu shot. You have some of us immune compromised people. Some people with ag allergies are still not getting it, though there are new formulations out for those people. But still, there are some people who aren't getting their flu shots for one reason or another. And by you having yours, you're actually helping protect the spread. So you're protecting them as well. Excellent.
I think that's sort of a nice feeling that you're doing something for yourself and others. I think so, at least. I know that there's always a conversation about feeling like a little bit unwell after the flu shot, or I know people say that they sometimes get the same symptoms for a day or two afterwards. What would you say are the most common side effects a person might experience after getting their shot?
So the most common side effects most people experience would be pain or redness or swelling at the injection site. Some people will get mild symptoms like a fever, headache, muscle aches, fatigue. The flu vaccine itself, it's an inactivated virus, so you can't actually get the flu from the flu vaccine, but you may have symptoms that can mimic it.
Okay, so that's important to keep in mind, that if you do have some sort of fever, you're feeling those sort of body aches, it's not the flu, it's just
Right.
the immune response to the vaccine.
Exactly.
Right.
Okay, that's good to know. I know for myself that like little bit of soreness in the arm, I feel like it's so worth it because it goes away in a day or two, and then like you feel so much better about doing things during the winter months after you've
Right.
had that vaccine.
Exactly. Yep.
And when do you think is the best time to get the vaccine? I know that there's a lot of conversations about timing your vaccines and can you time them? But if you had someone just in your office interested in the vaccine, when would you tell them is the best time to sort of get vaccinated against the flu?
The best time is anywhere from late August to early November. You
Okay.
want to give the vaccine about 2 weeks to really get the immune system going. And the vaccine actually usually lasts about a year. So it's not protecting just in flu season, but beyond. But getting it about the same time every year because they change which strains of flu. There are a bunch of
Mhm.
strains of flu out there. We've heard famously years ago of the H1N1. There have been other strains. So what happens is that the vaccine manufacturers try and look at what are the most prevalent flus going on in other parts of the world when it's winter there, and
Mhm.
they try to put those into the formulation when they produce it, so that each year you have a slightly different flu vaccine, but getting one every year usually gives you the best protection.
And that year-long protection comes in handy when we break for the spring and summer months, and flu is still sort of circulating. It's just not
Right,
as
that's perfect.
active.
Yeah.
Yes. What would you say if you had a patient in your office who either had never received a flu shot or it had been so long since they'd had one previously that they're a little hesitant to get their flu shot? Do you have any advice for people coming from that sort of perspective?
I think for most patients who are a little hesitant, it's a benefit for everyone.
Mhm.
Again, like Dr. Strauss had mentioned before, it's not only protecting you, it's protecting others around you. So I think when people think of it in that regard, they're more willing to get the flu shot, whether they have um, elderly people living with them at home, like family members, or somebody whose immune system isn't as great and can't get the flu shot. I think when you think about it in terms of you're not only protecting yourself, you're protecting like your bubble of people
Mhm.
that you're always seeing. I think that helps people, and they're a little more inclined to get the vaccine.
Dr. Strauss, would you say something similar?
Totally. And I always tell patients, you may have had a bad reaction, but if you understand why you're having the reaction, many
Mhm.
times it helps you out. So it's not like I got the shot, I got the flu. It's you got the shot, you got the symptoms because your body reacted. So sometimes
Mhm.
it's actually kind of a good thing. Your body reacting is now ready for when the real flu shows up.
Excellent. I have one last question for you both, and then if there's anything else you want to share about the flu or the flu season, you're more than welcome to. But I just wanted to remind anyone who's on the live, if you do have a question, now is the great time to type it in the chat and we can answer it. I know that we have our next round, our COVID boosters are also out right now. So I'm wondering if you recommend people getting flu and COVID at the same time, or if spacing them out maybe a week or two in between. How do you answer that question for people? Is it just a personal choice?
Well, there are a couple of things you have to look at. Now, the CDC and the FDA have found that you can get both shots at the same time.
Mm-hmm.
So if it's a matter of convenience to get them both at the same time, that's fine. Sometimes they'll realize that your reaction might be a little bit stronger, or you might have two sore arms instead of one. But other than that, there's really not that much of a problem in getting both of them at the same time.
Okay. Dr. Patel, is that sort of the same guidance you'd give a patient?
Yep, yeah. It's completely safe to get them both at the same time. So what if patients feel they want to get both at the same time, it's totally safe and
Mm-hmm.
you can do it. Get two birds done with one stone, right?
Yeah, it saves you an appointment, right? You're
Exactly.
there.
Yeah,
It's only another couple of what, like 10 seconds, maybe not even.
exactly.
And then you're good to go for the fall and winter seasons.
Exactly, right?
Excellent. Well, thank you both for joining us. I don't see anything in the chat right now. Did either one of you have any final comments about flu season, vaccines?
All I would say is, the general precautions we've been having for COVID is if you're sick, stay home.
Hmm.
Don't want to pass things around. When you're coughing and sneezing, remember to wash your hands. Even before COVID, I was telling patients, best way not to spread things around is don't cough and sneeze on people and wash your hands.
Very sound advice for any season. Well, thank you both so much for joining me today. And if you were here on the live, thank you for being here. If you're watching the replay, thanks for watching. And I hope everyone has a great afternoon.
Thank you.
Thank you.